When it comes to clinical psychology, there are a number of different areas that you can specialize in and a number of different kind of clients that you can work with. So what I'd like to do in today's video is go over a couple of those specialty areas that you can specialize in after you get your degree. After completing graduate school and internship, you can then choose to further specialize within a particular area of clinical psychology for providing health services. Geriatric psychology, or geropsychology, is a specialty that focuses on mental and behavioral health concerns for older adults. Now, the vast majority of geropsychologists have graduated from doctoral programs in either clinical or counseling psychology. Most geropsychologists offer services to older adults or their families, or the teams that give care for older adults in either healthcare or residential settings. Generally speaking, neuropsychology is the scientific study of brain behavior relationships. Now, clinical neuropsychology is the application of scientifically collected knowledge for the purposes of evaluating and treating individuals with known or suspected brain disorders. Clinical neuropsychologists may provide assessment or treatment services to children, adolescents, and adults, depending on the specific competencies and interests of the neuropsychologist. Clinical neuropsychologists who provide health services can spend a lot of time administering and interpreting cognitive assessments for brain function. Now, clinical neuropsychology is a highly competitive specialty for psychology, typically with higher compensation compared to other health service specialties in psychology. And to become a clinical neuropsychologist, it's important to plan in advance because there are several steps to be classified as one, especially in the United States. Psychologists specializing in rehabilitation psychology help people with disabilities address limitations in psychological, familial, social, and vocational aspects of their lives because of either physical, cognitive, or emotional aspects of their conditions. Now, rehabilitation psychologists provide services to clients with a wide range of disorders, typically encountered in medical rehabilitation settings. This could include catastrophic illness such as cancer, traumatic injuries such as spinal cord injury, and chronic disabling conditions such as deafness, hearing loss, and impaired vision. Now, sometimes rehabilitation psychologists can even further specialize in a particular area or a unit of an outpatient or inpatient setting for a specific diagnostic group, or specialize in working with one particular patient population. For example, working with individuals with traumatic brain injury or chronic pain or amputation. You can even specialize within a specific age group like older adults or children. A child psychologist is a psychologist who specializes in work with children and adolescents in a variety of settings, including inpatient, outpatient, and school settings. Now, a child clinical psychologist works with either children, their parents, and sometimes their entire families to handle a variety of developmental, emotional, and behavioral problems that children may have. Thank you for watching today's video. Do you have any questions about any of the specialties we talked about? Or maybe you have a favorite specialty that you want to learn more about? For any and all questions, make sure to leave them in the comments down below. Thank you for watching.